You're welcome. You're welcome. Well, Soji has said a lot about me. Emphasis sake, my name is Dr. Awajima Chutanko. I'm a clinician, medical doctor here at Federal Medical Center, Nguru. And I've been working with the pediatrics department. Based from our previous classes, we've learned from our students violence issues, how they were able to handle it, the gaps, and we're able to fill it up through this medium of training. And the aim of our training, or the aim of Afrocentric Masterclass on gender-based violence, is to raise awareness in our society, in our community. The vision that our CEO, Mr. Soji, have seen, and he this program. We are seeing the need in our community to raise awareness on issues that has to do with gender. Along the line, we joined and we also shared this vision. And I believe most of us that are in this class also have seen the need to create and raise more awareness in our society and communities concerning the issues of gender. Over time, there are things have been evolving, and that's why we feel like there should be change of the narration on issues in our society. And I believe everybody that's here has one thing or the other that he or she can contribute to make our society better when it comes to issues of gender. Some of us here are clinicians, some of us are advocates, and we are not only training people who are going to go and become clinicians alone. We also are very happy when we see people who are non-medically inclined also pursuing this vision of raising awareness in our society on gender-based violence. So teachers, students, lawyers, community training. It is not a one-man team. We need people, those who are going to become advocates in our society, in our communities, and those who are going to become the coroners of the issues of gender-based violence in our communities and also in our health facilities. So that's why everybody is important here. Not important. You being here is a very good thing to do and to consider. Just like you started from our previous class yesterday, I believe the facilitator was able to take you through on the introductory aspect of gender-based violence. And when we talk about gender-based violence, we always want to clarify to our students. They should be able to identify what gender is, what is sex, because it is very important. And why are there differences, or why are these things issue of importance in our society? So I will be calling names. So just like I said, it's an interactive class. I will be calling names. If I call your name, you can unmute your mic and say and contribute to the class. So from the previous class, what did you understand by the word sex? Mr. Buba. What do you understand by the word sex? You can unmute your mic and share your thought.
Hello, sir.
Yeah. Yes, sir.
Right? Okay.
Yes, I can hear.
Sex, okay. Sex simply means or refers to together of men and women based on marital status in a simple way or in a simple context. Is it made? Or do you need further explanation again?
No, I just say you should share your thought.
Sex is
Hilda, it's okay, it's okay, it's okay. Hilda, you can unmute your mic and also share with us. What do you understand by sex? Based on the lecture you had yesterday, and also based on your own. Hilda, unmute your mic. Unmute your mic and say something. Hilda, we are not hearing you. Grace. Grace, what do you understand by sex? Emmanuel Elechi, what do you understand by sex?
Okay. Sex, I want to look at it on the issue of gender as a position of being either a male or a female.
Okay.
Then, okay, I don't know if I should talk about sex in the other aspect of intercourse.
Okay, you can go ahead.
Okay, it has to do with the relationship that has to do between either an individual with another individual.
Okay.
That has to do with physical contacts of the body.
Okay. It's all right. Thank you.
All right.
Okay. Fatima Dauda Lago. Tell us, what do you understand by gender? Fatima, sorry if I'm not. Fatima, Bello Muhammad, what do you understand by gender? Aisha Muhammad. Aisha Muhammad, what do you understand by gender?
Okay, sir. Can you hear me?
Yes, we can hear you.
Okay, when we say gender, simply means refers to the characteristic of a woman or men, either girl, boys that are socially constructed.
Okay. Based on social construction. Okay. It's all right.
Yes.
So, thank you very much. I don't think it's when I also ask us to also discuss what you understand by the word survival. Ugochukwu Grace. Ugochukwu Grace. What do you understand by the word survival? A survival in the context of that survival. Phoebe Francis Kaza, what do you understand by a survival? A survival in the context of gender-based violence. Maigwa. What do you understand by
was survived or has experienced very challenging or traumatic situation?
Okay, you can frame it much better in the context of gender-based violence. Yes.
So somebody who has survived, who has experienced sexual assault.
Okay. Only. It's okay. That's a good. Inua. Peace. What do you understand by a survival? Okay, peace is not there. Eunice. Eunice.
Yes,
Who is talking?
yes, sir.
Who is talking?
It's peace, sir.
Okay, I'm going.
Only understanding. A survivor is someone that passed through rape experience who may be supposed to have died because of the outcome or trauma of consequence, but incident.
Thank you.
Okay, thank you. That was. We'll now move to the next word that I want us to also take note. Who is a victim? Who is a victim? Eunice. Eunice. Who is a victim? I said our class is an interactive class.
So, sir, a victim can, let me say, somebody that has gone through some sort of physical trauma, emotional, and somebody that is directly affected. by some situations.
Thank you for a good try. Dada Jibir. Dada Jibir. Who is a victim? Who is a victim?
Victim, a victim is somebody that has been exposed to an abuse but has not yet spoken out, is not ready to open and say what has happened. So he becomes a victim. He or she becomes a victim.
It's all right. Thank you very much. That was a good try from all of you. It really shows that you've been following the previous class. But however, I want to also make it very clear to us in this class that for everybody that's passing through this class, you must be able to distinguish between these key terms. Sex. What is gender? What is a survivor? Or who is a survivor? Or who is a victim? What is sexual assault? What is rape? What it entails? So that's why I want to re-emphasize and consolidate on the previous knowledge that you've acquired on this. And don't forget, we are talking about gender-based violence. So when we are talking about gender-based violence, and we are talking about when we say sex, sex is a biological determination of an individual. Say he is a male or a female. It's a biological determination. So it is determined by genetics. It doesn't change. It doesn't change except with a surgical intervention. Are we together? Is a permanent thing. Are we together? So what determines that? So the presence of the what? The male reproductive organs, the female reproductive organs makes one a male or a female based on sex. Are we together? Are we together? So now, when you think about gender, gender, just like some of us have rightly mentioned, it is a socially ascribed role. It is a socially ascribed role to a particular gender or to a particular sex. When there are rules that have been ascribed to a particular sex, say a male, there are things that in that community or in that country or in that society is known to be done by a male. So all those things are considered as what? As gender, and likewise for female. For instance, it's more in most of our communities, like cooking food, for instance, is commonly associated with what? With the females. Washing plates is commonly associated with what? With the females. But however, to go and hustle and cater and bring food is generally considered as a male responsibility. So that is what our society has constructed, and it changes. These rules can change over time, unlike sex that is permanent except surgically intervene. So you need to understand this. Now, when we talk about a survivor is an individual who has passed through a sexual abuse. You understand? Because of their resilience, so this word is very important. Because of their resilience, they were able to pass through it, and they are seeking for what? For help. Because of their resilience is very important in this in the definition of a survivor. Are we together? So now the individual can pass through that and they are not seeking for help, or they have not yet reached a point of what? Of saying, I need help. So those individuals, we consider them as what? As victims. They are victims. They are not yet survivors. Are we together? So that distinction is important for us to understand, because those ones that they are survivors because they are seeking for help. Those ones that we get to know, they are survivors. So we need to help them well. Some will die in that process without seeking for help, and they will die as what? Victims. A victim is still undergoing that process of abuse, and they have not really yet reached the point of what? Seeking for help. So, sexual, psychological abuse of an individual based on their sex. And usually, you need to understand how this thing works. Why these things happen is because there is usually what we call power distribution, unequal power distribution in our society. So there are individuals that are seen, that are perceived to have power over others. Generally, the society tends to empower men, male or men over females. So because of that, because of either that perceived power or because of the real power, the power can be perceived because the person who is being assaulted believes that the perpetrator has authority over them. So because of that, they perceive that he has authority and he can do anything to them. Are we together? While in the other context, it may be a real power. The person actually have a real power over the other person. So because to what? To exercise his authority over the other, their authority, or that is not up to their authority. So because of that unequal distribution of power, that is what leads to what? To sexual abuse or sexual assault, to a certain extent that we say rape. And I want us to be very clear. As a clinician, as an advocate, you cannot call sexual assault a rape, but it will only remain a sexual assault until it has been what? Pronounced a court of competent jurisdiction. It is only a court jurisdiction that pronounces a rape. So you and I don't have that authority to call a sexual assault a rape. But however, we can gather the evidence for the court to be able to use to determine that this is a rape or not. Are we together? So with this, we'll go on to build on our class. So the objective of today's class is to demonstrate clinical skills appropriate to one's profession and specialty to respond to violence against women. You about violence against women, it is not because men don't experience violence, sexual violence, no. But because the greater proportion of individuals who pass through this are female. So that is why females are mentioned frequently when you talk about gender-based violence. But however, it occurs to both sexes. what are the competencies that we want each and every one of us to develop in the course of this series? One is to demonstrate skill to take good history from a survivor, at some instance, from a victim. Why am I saying so? Come out and say, this is what it is. Report. And you may feel as an advocate, you need to intervene. So at that point, that person didn't come by themselves, but somebody brought the issue and you need to take it up as an advocate. So that is why that person has not yet understand that they need help. But however, it's our job as advocates to make them aware that they need help and they can actually be helped. It is not a die sentence. So, and another competence that we want us to develop in the course of this series is to know how to conduct physical examination, and also to know when to collect forensic evidence and how to support or facilitate this. So in the course of this class, we will come to see what we need to be able to collect forensic evidence. And the word forensic may be new to some of us, but forensic evidence or forensic simply means foreign to the body of the individual. Some things that are brought to the body they are not initial or ab initio, they are not part of it. Because of this sexual experience, so those things are considered what? As foreign. So they are considered as what? Forensic what? Evidence. So in a simpler term, that is what forensic means. And evidence, just like the word evidence, they are items that we use to say this thing is A, this thing is B, no, or this thing is white, or this thing is black. Are we together? So now, this chart is very, very important. You need to understand this chart. If you are able to understand this chart, you are home and dry for us today. So I will dwell much on this before I move on. And afterward, I'll be quite fast about it. So, but however, we'll take our time to digest what this slide is talking about. So when you look at our algorithm here, it says summary protocol. That is pathway for initial care of sexually assaulted individuals or patients. So now, what does it entail? When you look at it critically, it is divided into two parts. There is the first line support, there is the first line support 2, first line support 1, and first line support 2. Why is it divided like that? For most of us that are health related, you know, safety is first. For any situation, safety is first. So when an individual is presented or a survivor is presented to us, so we need to ensure that they are safe to be able to remain alive. They are safe to remain alive before we go on to do other things that we need to do. And what endangers the life of a victim or a survivor? Injuries is a sexual assault. So the propensity of them developing injury is very high. So, and at the first instant that you are seeing them, that we are seeing them, we try to rapidly evaluate, is there a life-threatening injury to this individual? If you answer the question as yes, why will you answer that question as yes? There are telltale signs. The patient presents, the incident happened maybe in less than 2 hours, in less than 10 hours, in less than 1 hour, in less than 1 day. And they present, you can see visible what? Bleeding. Their clothes is soiled with what? With blood. So you have to identify where is this blood coming from. Immediately, instead of you not waste your time by trying to say you want to take history at that point. You want to identify instantaneously where is this blood coming from. Once you identify it and what, you arrest the bleed. Until the patient remains alive before you can be able to what? To take history. Before you can be able to what? To do other things. So that is why that step is very important. Once the patient presents urgently, you quickly evaluate and see, is there bleeding, or is there a potential for what? For bleeding in this individual. There may be a laceration that is bleeding. There may be a bruise that's bleeding. There may not be an open laceration, but however, through their vagina, there may be bleeding. Through their anus, there may be bleeding. Through their urethra, there may be bleeding. So those are the things that you want to address to stop that bleed. Is the patient needing blood instantly? Yes, go and look for blood. If you have the capacity to do so. But if you don't have, immediately what? Send to a facility that they can be able to what? To offer this service instantly. Are we together? So that is why this stage is very important. Once a sexually assaulted individual presents to us, we need to rapidly and quickly evaluate and answer this on the affirmative, that is yes or no. If the answer is no, that is there's no risk of potential bleeding, or there's no real bleeding in this individual. So we'll now move to the next stage, which is what? Listen. How do you listen? By asking questions and allow the victim to what? To talk. And ladies and gentlemen, I want us to be very clear here. You don't rush these individuals. These are not category of individuals that you say you want to rush them to take the history. Allow them to talk on their own pace. You don't rush them. You ask questions with empathy. You ask questions with empathy. Make sure your full attention is with them. If you need clarification, allow them to finish talking, then you validate. So there is a framework of what you need to follow in getting this information. First of all, you need to take the biodata of this individual, the biodemography of this survivor, their name, their age, whether they are male or female, where are they coming from. You understand? All this information, the person that is accompanying them to the clinic or to the facility, all these key information need to be stated. At what point did this incident happen? In which community? In which, is it by the road? You understand? All this information, you need to get them. Then you now take the history of the assault. You understand? You take the history of the assault. They will tell you it happens like this. They were walking. Depends on the scenario, and suddenly they saw a gang, or they saw one person came, hijacked them, or he did this, or they did that. They will state it. And ladies and gentlemen, at this point, you need to state it as what the patient is saying, or what the individual is saying. You don't say it in your own words. You say it in their own word. You don't lose key information in the course of translation. You understand? So afterward, you take the if it's a female, you take the gynecological history. The gynecological history involves, are they married? Are they single? Are they pregnant before? All this information, you need to get them. Have they married before? Or are they still married? Are they still married? You understand? These informations are important in the gynecological history. And whether they are using contraceptives, information you need to take them at the gynecological level history. Whether then you need to take other what? Medical history. Do they have other medical conditions? You need to get this information at this point. And afterward, you go and assess their what? Their psychological state. So all these things, you will do it with what? With empathy. You don't rush them. And this history, I'm not saying that this history can be gotten in just one sitting. No. We don't rush them. We can take our time to take this history over 1 day, 2 days, 3 days, depending on the psychological state of these individuals. If they are not cooperating or they don't feel to talk, don't force them to say anything. Allow them and come back when they are more stable. So now you now assess for what conditions found that need treatment. So based on this interaction with the patient, you'll be able to identify, does this patient has, yes?
Yes, sir. And we are not seeing the slide because you are covering us.
You're not seeing the slide?
Yes, sir. You are covering us, so we are not seeing the right.
We are not following properly.
Don't worry, I've minimized it. Don't worry, it's me. I've minimized it.
So thank you very much.
Can you see him now?
Sorry about that.
Don't worry.
It's still blurry. It's blurry.
Okay, don't worry. Let's change the setting. Don't worry. Continue. I will change the setting. Don't worry. It's the setting I'm using.
Thank you very much. Thank you for that input. So you assess other conditions. In your interaction, you may identify other sinister signs that this individual has some potential to have other issues. So you address them. So when you identify those things, it's either yes or no. If it is yes, the slide have disappeared.
Okay, you can reshare now. You can reshare, Dr. Matthew. You can reshare it. Then, if you are watching it on your phone, you can pinch it and expand it to your phone. You get what I said? Dr. Matthew, you can reshare. So if it's not bold enough,
I'm sharing it now.
Yes, you can share now. Yeah.
Can you see?
Who is this person disturbing the class now?
The slide?
It's blurry.
No, it's not blurry. Expand it by yourself. Expand it. Expand it on your phone. It's not blurry. Just expand it like that. Expand it. Pinch on it and it will show. On your phone, touch the screen of your phone and expand it. Because you are not using your laptop. Me, I'm using laptop now. I can see it clearly. So since you are using your phone, pinch it on your phone, touch it and expand it and drag the way you are doing Canva design. Touch it and expand it. Try it. Dr. Matthew, go ahead. Touch it and expand it. Like pinch, you drag it.
So if you'll be able to identify that this patient has some conditions that you may not be able to handle, then you can either treat if you have the capacity to do so. If you don't have, you refer to a facility that has the capacity to address that kind. So the next thing that you need to inquire is this incident happening within the first 72 hours? If your answer is yes, then you need to act by offering what? A post-exposure prophylaxis. what? That is 3 days of this incident of the assault. You need to take action. You need to protect these individuals from what? HIV. But however, that's what I said, in your history, you need to take their what? History of their medical history. So at that point, you will know whether they were actually having a HIV illness or not. If they had the illness before that incident, so they are already on what? On HIV medication. So you get to know at that point. But if they are not, then you need to protect them from becoming infected with what? The retrovirus. So, and the post-exposure is a what? It's not a one-time thing. You give it over what? 28 days. Protocol. Different organizations have their protocol, but the common is they use what? Nevirapine. 28 days. So 1 month. It's not a small thing. Medications has their own side effects. So this patient need to be motivated. Survivor need to be motivated to as a result of what? Of what? Cooperation with the treatment. So the next thing that you need to also do is this incident also within 5 days? If the answer is yes, then you need to take action. You need to take action. What do you need to do? You need to offer what we call emergency contraception. If the history you got from her gynecological history is she's a single lady or she's unmarried and she was not pregnant, so you want what? Prevent the chances of her becoming pregnant if she is a female. So contraception here, there are different methods, or there are different things to do. The emergency contraception basically are classified into 2. We have the IUCD devices, the intrauterine device, and the hormonal. Copper T and the other IUCDs. So if it's within 5 days, you offer them, and the best is the IUCDs. However, the hormonal also are effective, but both of them, they are not 100%. For the IUCD, only a pregnancy that has not started that this can take care of. If a pregnancy has already started, this is outside the scope of this class. Are we together?
Outside the scope of the class, sir?
Yes. If a pregnancy has already implanted, there are so many things to that. Don't worry. If you have a question, reserve your question.
Okay.
If you have a question, reserve your question. So, the other method is the hormonal. The hormonal, we have the ulipristal acetate, which can be given as a single dose. So it's also effective in preventing what? Pregnancies in the emergency setting. Others are what? The combined oral contraceptives and also the what? The progestin pills. So what other thing do you need to do to this individual? You need to protect them against what? Sexually transmitted infections. So you need to offer them prophylaxis, and there are different regimens in taking care of sexually transmitted diseases in this group of individuals. Based on your suspicion, you offer them what they need. So now, the first line support 2, all these things that we've talked about is within the first line support 1. And that is to say, if a patient presents within this period of time in less than 5 days, you can see that's when we can be able to do some of these things, and also within less than 72 hours. If a patient presents beyond 72 hours, you know that your PEP cannot be able to offer protection against HIV. They are now what? Predisposed at that point. Why is it important? It is not all these victims or survivors that will present early. Some, they will present late, over 1 week, over 1 month. So that is why in those period of time, there's barely nothing you can do concerning these ones. Are we together? So the first line support 2, now you need to ensure safety. For instance, our patient who are survivor came from a family or from a community within the first 24 hours, and the perpetrator is in that same house. Will you want to see this patient and ask her to go back home? No, obviously. So you want to offer safety, and you want to connect her to what? With people who will help. We have the community-based health resource, which include the NGOs that are taking care of some of these issues, and also the Ministry of Women Affairs at the local government level, at the state level. They are all there to cater for these kind of issues. So you link them. So it's not something that you just see and not do anything about. You may need to link her, the victim or the survivor, to a what? To a psychotherapist. So that is why the first line support 2 is also important. You enhance safety. You enhance, you can see the word we say enhance. Coming to you is safety. But if you don't do the necessary things, that safety may not be enhanced, and you ask them to go back to that same environment that the perpetrator is in. And over 50% of individuals who have been sexually assaulted, or women who have been sexually assaulted, over 50% of them is by somebody they know. It's not a strange person. So you can see the next thing is what? To do for what? For follow-up. To you plan for follow-ups, close follow-up visit. Then you begin to what? To increase the time based on the what? The response of our survival. In the space of 2 weeks, 3 months, 6 months, 1 year, until they're able to come out of that situation, and they have become self-sufficient. They are well rehabilitated. So you can see this is the algorithm that every one of us need to understand. So I want now, most of the things now is just discussion as we keep on going. So I've done the main talk. I want somebody to unmute. Rebecca, unmute your mic and read this brown area. What is it talking about?
Okay. Immediately refer patients with injury that need urgent care. Otherwise, number one, first line support, listen, inquire, and validate. Number two, take history, examine, assess emotional state, plus do full forensic exam if needed. Number three, treat any physical injury. Number four, offer PEP or HIV prevention within 72 hours. Number five, offer emergency contraception within 5 days. Number six, offer STI prophylaxis and presumptive treatment. Number seven, first line support part 2, enhance safety support. Number 8, assess mental health, discuss self and plan follow up.
Thank you, Rebecca, for that reading. So you can see these are the things that I've discussed in this flowchart, in this algorithm. So subsequently, we'll be just highlighting. So Francis Kaza, unmute and read this slide overview. Gloria Yusuf, unmute your mic and read this slide.
Okay. Overview. Number one, take the history. 2, prepare for physical examination. 3, conduct head-to-toe physical examination. 4, conduct for a forensic examination. When and what to tell her. 5, treat.
Thank you very much. So take history. We've highlighted the component of the history, but you get to see them more as we go. Then prepare for physical examination. So this preparation entails you don't do the examination alone. You need things that you will use, and you need a third person. You don't do it you alone with the survivor or the victim. You need a what? You need someone to be around. So that we call a chaperone. You need a chaperone. And if you are a male, you need a female. That is a colleague. You need a female colleague to join you. If you are a female, if the victim is a male, you need a female to be part of that examination. You understand? So, and you need the kit. There's what we call the examination kit or the forensic tool kit, where you are going to collect these things, the samples that you get, and also conduct head-to-toe examination. What do you mean by head-to-toe examination? we are referring to from their how the nature of how they present, their whether the hair is loose, there's pulling of hair. You don't touch it, you don't alter anything once they present. The way the patient or the victim present, you seek for consent at every given opportunity. Before you start asking them questions, tell them the importance of why you need to take to ask them questions so that they can be helped, and why they need to volunteer information, and you also need to assure them of confidentiality. So at every step, you need to assure them of confidentiality, and also seek for consent. So from how is the appearance, their hair? Is the hair looking loose? Is there part of the hair that has been plucked? So all these things, they are important. In the face, what can you see? Are there bruises? You don't alter anything. You don't ask them to go and bath. You don't ask them to go and bath. So you take pictures, you seek for their consent and take pictures of the hair, the clothes that they present to. Are the clothes looking torn in some areas? You snap them the way they are. Is there blood? You snap it the way it is. You don't alter the evidence. You also, are there bruises? Are there lacerations? And commonly, areas where there are injuries is what? The breast, the genitals, and the anal region. That is the anus. So these are areas of high injury. They are prone to injury in a sexual assault. Their mouth, you don't ask them to wash their mouth. You need to take swab. So you go to their tummy and look at what can you see. Anything you see, you document. You take pictures. You seek consent and take pictures. You go to the vaginal area, you look at it. If there are injuries, and at this point, any injury around the perineum, we describe it according to the hand of a clock. You see, if you are describing, you say there is an injury around 1 o'clock, around 12 o'clock, around 6 o'clock, around 9 o'clock, around, you understand? That's how you describe the injury. And the nature, is it a laceration? Is it a bruise? Is it an avulsion? All these ones, you will describe them the way you see them and also snap them. Are there smeared semen on the vulva? You snap and also document. And also take swabs. So you as part of evidence collection, you also you loosely comb the hair. You loosely, not by force. There may be hair follicles or hair of the perpetrator that may fall, and anything that falls, you gather it and put it into the forensic toolkit. That is, if your facility has that capacity. And all this evidence, you tell the victim that you need to take it if they consent to it. But if they don't consent, you don't force them. But however, you tell them what they stand to lose, because evidence may be may not be able to be. You may not be able to get this evidence after this time, and it means you cannot be able to she may not be able to be helped as she would want to be helped, maybe if she changes her mind. So, and conducting the forensic examination. Conducting forensic examination is actually a specialist kind of procedure. You have to be trained for you to take a forensic evidence. You have to be trained, let me tell you. If you are not trained, you may not be able to take forensic evidence. So there are experts that are trained on forensic evidence collection. So all these things that you hear me mention, they are things that you need to go into details if you are taking your forensic evidence. And then you treat as appropriate. Just like we've mentioned, is this incident happening within 72 hours? Yes, you offer PEP, you offer contraception. Is it happening beyond 72 hours? But however, within 5 days, yes, you offer what? Emergency contraception. And also offer what? Prophylaxis for sexually transmitted disease. Offer them psychological support by linking them with what? Psychotherapists that will help them come out of this situation. And you make advocacy. So, and if she has consented to collecting the forensic evidence, then you need to report to the police. However, every sexual assault situation, incident, is a reportable case. It needs to be notified to the police. So we are moving. So let me see. Eunice Lini. Eunice Lini, read this slide for us. Nathaniel Bassi. Nathaniel Bassi.
Yes, I can hear you, sir.
You can go ahead and read this slide for us.
Okay, sir. Maintain respectful attitude. Calm voice, eyes contact, and culturally appreciate. Can you hear me, sir?
I can hear you, or we can hear you.
Okay, the next one is ask for consent respectful separately. That is for history. Sorry, I'm trying to see what is here because I'm using my phone.
Okay.
Hello?
Yeah, go ahead.
Yes. Okay.
Are you struggling to see?
Yes, I'm still struggling to see the other part of it because I'm using my phone, not my laptop.
Okay. Let's see, Kauna. Maybe somebody will take over from you. Kauna. Fatima,
Sorry, my environment is noisy.
Okay, it's all right. Engineer Adati.
Maintain respectful attitude.
Who is talking? Who is talking?
Let somebody else talk. Let somebody else talk so that we can move. Somebody
Joy
else
Haruna.
can move. Let somebody read
Okay,
for
I
us.
demand.
Maintain,
Let me.
let me
Maintain
try.
respectful attitude. Calm voice, eye contact as culturally appropriate. Should I continue?
Oh, go on, go on.
Okay, ask for consent separately for history taking, examination,
forensic evidence collection, and for reporting / sharing of evidence. Then we have avoid distraction and interruption. Then lastly, take time to collect all needed information.
Thank you. So you can see that you have to be mindful of the context. Which culture are you dealing with? For instance, in the north, you cannot be looking at a northern woman eyeball to eyeball. It's not accepted. So you have to be aware of the cultural orientation while taking your history. And you need to maintain a calm voice. So it's not a situation whereby you'll be rushing and be shouting at them because they are already traumatized. So if you decide to become aggressive, you will become what? They will not to offer you the information that you need, and you may not be able to help them. So that's why that atmosphere must have to be quiet, the atmosphere must be calm, and you have to be aware of who you are dealing with. Then the next thing is you need to seek for consent at every given opportunity. That is, from history taking, you need to take consent. If you want to start examination, you need to seek for consent. If you want to take forensic evidence, you need to take consent. So you need to tell them at every given time that this is what you want to do. Can you go ahead and do it? Yes, their mic is not muted. Okay. You need to take consent at every given step. Is very important. And before you take that forensic evidence, tell them, I need to take this because it will enable us, if you decide to change your mind in the future, that you need this thing to be pursued in the court. So these are the things that it will be used to confirm that this thing happened to you. So even if you have not made up your mind now, but however, if you change your mind in the future, this will be very, very important and it will be needed. That is why we need to take it. So she will tell you yes, or she will still insist that no. And you need to respect their decision. And this, like I said, you need a chaperone, and also you need to also come along with what? Someone that they also feel comfortable with from the people that they come with as part of the team that will take this evidence. So you ask her, who do you want to be present in this process? They will tell you, Mr. A, Mr. B. You let them in. Are we together? So avoid distraction. So this is not a situation whereby you'll be interacting with them and suddenly your phone rings, you just pick and start talking. Or somebody is passing, you are waving at them. No. You ought to maintain an optimum of what? Decorum. And you have to what? To be respectful. So take time to collect all the needed evidence, and don't be doing forward and backward. That is, if you ask a question, then you just, after a while, you still ask the same question. No, these are not the kind of that you do that kind of attitude. So once you ask a question, make sure you got all the information you need and don't repeat it, because some of those answers are really traumatizing to them. So it's not something that they wish they want to be talking about over and over again. We'll move to the next slide. So somebody should read. Patience Meyaki.
Okay. History taking. Purposes to guide exam so injuries can be found and treated. To assess risk of pregnancy, STIs, HIV. To guide specimen collection and documentation. 4 parts to history. General medical information and history of assault, then gynecological history, and assessment of mental state.
Thank you very much. Ladies and gentlemen, like I earlier said, the 4 parts of this history taking that we are talking about, this is what they are. The general information, which I refer to as the biodemography of the patient, I've already highlighted. History of the assault. So gynecological history, I've all discussed these things. And assessment of mental status. So assessment of mental status involves you, based on the perception you have, you are seeing them. Are they looking sad? Are they looking moody? Are they crying? These are the information that you want to state in your mental assessment. Do they look hesitant? Do they look jittery? This is what they are. You are assessing them based on what you are seeing. Then the next thing is you ask them questions. How are they feeling concerning this incident? Are they having flashback of the experience? So they will tell you, yes, there is an doctor, I don't want to remember what happened. This thing is so painful. I am seeing this, I'm seeing that. They will tell you. So this is now them revealing what they are passing through. So we'll also come across a slide that discusses this more. Then, taking history of assault. Review any paper. Explain why asking. That is to provide best care. That is why you are asking the questions, to provide best of care. Ask open-ended questions. Don't ask close-ended questions. Which one are open-ended questions? Please tell me what happened. It's an open-ended question. So they will tell you the narration. So, and let her speak in her own words. I've mentioned this earlier. At her own pace. I've also talked about this one. And assure them of what? Confidentiality. Avoid asking questions already answered. Avoid forcing her to talk about the assault. If they don't feel to talk about it, you have to be quiet, or you have to allow them to process this information. That's why I say that this history taking is not an issue of something that you just come and do it at once. It can take you 1 day, 2 days, even 3 days, even 1 week, trying to get this information. So, and these are the various components: the date, the time. Could you tell me what happened, please? That is an open example of an open-ended question. And you will have a follow-up question. Has something like this happened before? They will tell you. So if yes, was the same person responsible this time? They will answer and tell you, this is a closed-ended question. It's a yes or no. You understand? So now when you come to your, you may also want to inquire, how many were they? They will tell you, she saw 10 people, she saw 1 person, she saw 3, or 1 person came first, then subsequently, so number, depends on the story. They will tell you, then you document. Then in your physical, then you assess for physical violence. Was there beating involved? So these are the various types of physical violence. Beating. So beating involves what? The person used a stick or an object and what? And involves striking their body, that is beating. Biting, that is using their teeth to what? To bite any part of their body. Hair pulling. Strangulation. Was their neck strangulated? So they would, based on their answers, so you describe the type of and the location on the body that the physical violence was inflicted. Was there the use of restraint? That's to say maybe the people there were 3 guys or 3 people or 4 people. Somebody held the hands, somebody held the legs, and somebody was what? Somebody was forcefully what? Penetrating into their private part or into their vagina. Understand? Or using penetrating what? Using their penis into their private part. It can happen in either direction. So that's why we are talking about it. Use of weapon. Was there a gun? Was there a knife used? So all this information you would need to inquire. Then drugs. When the patient presents, can they be able to relate to the surrounding? Do you think, based on their presentation, they were drunk? So you state, or the patient will also tell you, they gave me something I took, or the victim will tell you, they gave me something I took afterward, I didn't know what happened. So all these things are important. So now, the history of the sexual assault now. So was there the use of penetration using finger? Yes, you stated. Was there a use of penetration using a finger into the vagina or into the mouth, into what? The anus? You state it. They will tell you, then you write, or you tick if it is like this. Was there the use of penis into the vagina, into the anus? You state it. Into the mouth, into the ear, into the nose? You need to state it. That is why it is important. Why are we saying this? We'll talk about it in the next few slides. So this is assessment of the mental state that I've talked about. Mrs. Iyeningi. Mute your mic. Mrs. Iyeningi. Unmute your mic and read this slide for us. Victoria Sally Mairiga, unmute your mic and read this slide for us.
Sorry, I was trying to.
Okay, you can go ahead.
Trying to see, but I can't read it. It's too tiny.
Sorry.
The characters are too tiny for me.
Sorry. It's all right.
Thank you.
Peace Mayaki. Goodness K. Goodness K. Unmute your mic and read this slide for us.
They are telling you assessmental states, but the other characters are very, very tiny. I can't see them. Hello? The characters are tiny.
You can put your screen and zoom it.
Assessmental state. That's the only thing I can see.
Okay, let me read for you then. Can I read? Which one is that? Somebody's mic is unmuted.
Can I?
You can read. Whoever that has seen it clearly To read.
Appearance and behavior.
It's all right, go ahead.
Clothing, hair, agitated, distracted, restless, signs of substance abuse. Then mood. How do you feel? For example, calm, crying, angry, anxious, very sad, or without expression. Then speech. For example, silent, speaking, speaking clearly or with difficulty, confused, speaking very quickly or slowly. Then thoughts. Have your thoughts been hurting yourself? Have you thought about hurting yourself? Do bad thoughts or memories keep coming back? Do you see the event over and over in your mind?
Thank you very much. So in assessment of mental state, you need these parameters: the appearance and the behavior, the mood, the speech and thought. These are the parameters that you are assessing their mental state. And appearance is what you see on the victim or on the survivor. So we have already highlighted it. The mood, you need to inquire, you need to ask them, and they will tell you their response. So, and the mood, how do you feel? They will tell you, I feel calm, or they will be crying, or they are angry, or they are anxious, or they will tell you, I'm very sad, or they just remain speechless. So all these ones are talking about what? The mood of these individuals. Then the speech, if they respond, how are they talking? Even if they are not talking, the silent also is also a response. But if they are talking, how are they talking? Is it clearly heard, or you barely can hear what they are saying? Are they confused, or they are looking confused? Are they speaking very quickly, or they are speaking quietly, slowly? So this is about their speech. You also report it. Then they are taught. So thoughts, have you thought about hurting yourself? So they will answer. I think I've mentioned it earlier. Do they keep seeing repeated repeated event of the incident reoccurring in their mind? That's flashback. They will tell you. So they may respond by saying, I've been seeing this incident that happened within that process of this person that this. They will give you the information. You state it the way they told you. Do you see the event over and over again? So this is what they are taught. And that is how you assess what? The mental state. So move. Discuss reporting to the police. So if then the law requires you to report to the police. Now, we said in Nigeria, a rape case, a sexually assaulted individual, you are supposed to report. It's not something that you just see and keep quiet. It's not something that you attend and keep quiet. So if the law requires you to report to the police, tell the victim, tell the survivor, you will be doing this. What you must report, and to who, and why you must report. You tell them. Don't forget, they have to consent to it, even though the law requires that you report. You tell them that the law requires you to report this incident. Should you go ahead and report? They will tell you. And also, if they decline, you explain to them the reasons why you need to report so that they can be helped. And failure to do so, the consequences in the future. They may later want to change their mind, and this thing, you may not be able to track it. So that's why you need to report. And if you are reporting, evidence need to be collected. She wants to go to the police. The patient or the victim or the survivor will tell you, yes, I want this incident to be reported to the police. So if that is so, forensic evidence must be collected. What evidence what evidence collection involves? I've made talk about taking swabs. You comb their hair and taking the hair that fall off their body. You take oral swabs. You take vaginal swabs. You take anal swab. All this, you are collecting evidence. If there is any leftover of a residue from the assailant or from the perpetrator, then that is what the court is going to use. There will be usually a suspect, and those evidence, they will be put across side by side by the suspect, and at the end of the day, it will be confirmed that it's this person that did this. So now, in all this forensic evidence, when there is a kit that you collect this evidence and store them inside. There is a kit that you collect this evidence and store them inside and keep it safely in a room that is locked. No one has access. Not everyone has access to that place before somebody will come and take the evidence away. So collected. So if they collect evidence, and so I've already talked about that. For children and adolescents, access implication of reporting to health and for health and confidentiality. Attention to confidentiality if caregiver is the perpetrator. Like I said, most of these victims, the perpetrator is usually known by the survivor or by the victim. They know who did it to them. So that is why careful attention needs to be put into consideration here. So this is an e-learning material. You can read this one on your own to internalize. This is all about what you have been discussing all this one. So prepare for examination. Somebody, Roslyn Johnson, unmute your mic and read this slide for us. From now henceforth, we're moving very fast. Fiidi Mikhailu, unmute your mic and read this slide.
Hello, prepare for the exam.
Thank you.
Number 1, communicate. Stepwise informed consent. Specific support desired, for example, friend, family member. Choice of sex of provider. Number 2, have an observer present. Preferably a trained support person or female health worker. Introduce and explain role of observer. Besides the observer, keep the number of people to a minimum.
Thank you very much. I've talked about most of these things, but the role of the observer is to ensure that you are protecting yourself. For instance, if it's a female that is a survivor or the victim, and the examiner is a male, and it happens that it's only him and her that are in the examination room, and in the process, she feels so uncomfortable and decided to shout and say, he is doing this with me. Do you think he will escape? He cannot escape. So that is why the role of the observer is important. It's for your protection. You, the examiner, who is a male and the examiner is a female. So you need a thought. However, we also made mention that they can tell you that they want so and so to be part of the examination, the person that they feel they are comfortable with. So it's also allowed. So physical examination, agape, samania. Read.
Okay, physical examination, communicate. The first there is explain purpose of physical examination. The second is women may be sensitive to being examined or touched. The third is assure her that she is in control. Then the fourth goes, look at the woman before you touch her. The fifth is at each step, tell her what you are going to do and ask permission first. And the last one says, ask often if she has any questions and if you can proceed.
Thank you very much for that reading. So you can see, we have talked about most of these things, but just to highlight the purpose of the physical examination, we've already emphasized on this one. Just like we have read, men are sensitive. Men are more sensitive, in particularly if the examiner is a male. So you have to exercise some caution while you do that examination, and you need a chaperone. I will also say, bring a trained personnel to be part of that examination team. Then look at her, until she give you both verbal and non-verbal consent, because there is how somebody will act if you are trying to touch them, that shows you that they are not agreeing to what you are trying to do. So watch out for those kind of situations. If you perceive she's telling you you can go ahead, but her body language is different, you can tell her that you can postpone the examination until when she is more comfortable for the examination. At each step, tell them and seek for permission first before you go ahead. From the history, before you go to examination, and even in the examination, from head, if you are moving to the trunk, you take permission. If you are moving to the genitalia, you also take for consent. So at every step, you take consent. Once you are trying to touch them, seek for their consent before you do so. So, when should a forensic examination be done? Kauna.
Kauna. So that because almost
Dada Kabir.
Okay. When should a forensic exam be done? Only when, 1, forensic science lab is available. 2, woman has come within phase out. 3, woman wants to go to the police or reporting is mandatory. 4, trained healthcare provider is available. 5, only medical legal evidence that can be collected, stored and analyzed should be gathered. 6, hymen is a poor marker of penetrative sexual activity or virginity in post-pubertal girls.
Thank you very much. So you can see from this, you see those green dots, they are a must. Before you take a forensic samples or evidence, there must be a lab that will be able to analyze. And which lab? The DNA lab. So when you take those samples, they will need to what? To be taken to a DNA lab for that test to be what? Conducted on the specimen, on the swab, the oral swab that you've taken. It's possible they may have had what? Penetration into the what? Into the mouth or into the what? The ear. So there may be deposit or residue of what? Of semen in these areas, and that's why you are taking those swabs. At any opening, you take a swab. You take a swab. In the vagina, you take a swab. If there is smear of semen on the body, you snap it. If there is the hair is torn, you snap it. If there is a laceration on the breast, you snap it. Or there is bite, you snap it. If there is abortion, you snap it. If anything you see in the body of this individual, you keep evidence. And picture is also a good evidence. Their cloth is torn, you keep evidence. So when this woman presents within 7 days, it's another condition. And woman wants to go to the police. So if this case, we have to go to the police, there is need for what? Evidence collection. So also, trained healthcare provider is available. Forensic evidence, you have to be trained before you take forensic evidence. If not, you may not be able to give the correct description. And that is why you need to be trained on how to collect forensic evidence. So these 4 things are very critical. So medical legal evidence that can be collected. So only medical legal evidence. So what are they? Things that can be able to be demonstrated medically that A is the reason why this thing is here, or B is the reason why this thing is here. So it can be demonstrated scientifically, medically. And for some of us that will say the lady has no hymen, or hymen has broken. So a caution has been given. Hymen is a poor marker of what? Penetrative sexual activity or virginity. So you cannot use that one and say, now she's no longer a virgin. No, in particular, if it's a post-pubertal girl, because there are so many things that can destroy the hymen in this group of individuals. So avoid using hymen as an indicator to say she's not a virgin. No. So case study. I want a good reader first to read this case for us. We are coming to the end of our class.
Introduction.
A volunteer.
Okay. Introduction.
A sexually assaulted and raped as severe traumas that significantly impact survivors' physical, psychological, and emotional health. Providing comprehensive clinical care to survivors is crucial to their recovery and well-being. This case study examines a fictional survivor's journey through clinical care, highlighting best practices and disciplinary approaches. Case study. Patient background. Name, Jane Doe. Age, 28. Gender, female. Incident, sexual assault by a non-acquaintance at a social gathering presentation. Jane presented to the emergency department on Friday, ED, 24 hours for consult accompanied by a friend.
That's my phone. And they still brought another one.
Okay, it's all right. I will.
Yeah.
Who wanted to read again? If you take over.
Right, you do.
Okay, initial presentation and examination.
Thank you.
Number 1, initial assessment. Jane appeared visibly distressed and anxious. Secondly, she reported pain in her lower abdomen and multiple bruises on her arms. Third, vital signs were stable. The second item, triage and immediate care. Jane was triaged as urgent due to the nature of her assault. A private, quiet room was provided to ensure her comfort and privacy. Consent was obtained before any examination or procedure. Third, forensic examination. A sexual assault nurse examiner, SANE, conducted the forensic examination. Evidence collected included swabs, photographs of injuries, and clothing collection. Chain of custody protocols were strictly followed to maintain evidence integrity. Fourth, medical examination. Physical examination documented bruises, abrasions, and tenderness in the lower abdomen. STI and pregnancy prophylaxis were discussed and offered. Baseline STI screening and blood tests were conducted. Psychological support. 1, crisis intervention. A mental health professional provided immediate psychological support. Techniques such as grounding exercises and emotional validation were used to stabilize Jane. Referral to counseling services, second item. Jane was referred to a specialized sexual assault counseling service. Short-term follow-up appointments were scheduled to monitor her mental health.
Okay, before we progress, I would just want to emphasize techniques such as grounding exercise. When we say grounding exercise, we are simply referring to as they are psychological therapies used using the sense organs to allay or make someone comfortable. For instance, breathing pattern. You can ask the victim that you'll be breathing synchronously with them or to take a deep breath and relax. You understand? To take a deep breath and relax. To take a deep breath and relax. So these are what we are referring to what? Grounding techniques. It can be eye contact. You understand? So, and also it can be what? Listening to music, cool music that will allay their anxiety. That is what we are referring to what? Grounding techniques. Okay, you can go ahead.
Legal and advocacy support. Legal rights and options. Jane was informed about her legal rights and options, including reporting the assault to law enforcement. An advocate from a local rape crisis center provided additional support and resources. Second, protection and safety planning. Safety planning was discussed, considering her immediate and long-term safety. Contact information for local shelters and hotlines was provided.
Sorry, I'm coming. Go ahead.
Follow-up care. Number 1, medical follow-up. Jane had follow-up appointments with her primary care provider for ongoing medical issues. Repeat STI testing was scheduled as her protocol. Number 2, mental health follow-up. Continuous counseling sessions were arranged. Jane was encouraged to join a support group for sexual assault survivors. Number 3, community support. Engagement with support groups and community resources was facilitated to enhance her support network.
Sorry. Go ahead.
Multidisciplinary team involvement. Number 1, healthcare providers. ED physicians, nurses, and SANEs worked collaboratively to ensure comprehensive care. Primary care providers continued to monitor her health. Number 2, mental health professionals. Crisis counselors and long-term therapists were integral to Jane's psychological recovery. Number 3, legal and advocacy. Legal advocates and crisis center representatives supported her through legal processes and safety training. Number 4, community resources. Support groups and community organizations provided ongoing emotional and social support. Outcome and reflections. Short term. Jane experienced initial relief and support from the multidisciplinary team. She began to engage with counseling and medical follow-up. Long term. Jane's recovery journey continued with significant improvements in her mental health and well-being. She became an advocate for other survivors, sharing her story to help others.
Okay, it's okay. So now, thank you very much. So you can see from the scenario, from the case study, you can see how a sexually assaulted Jane was able to present to a health facility where she was seen, where she was attended to according to the immediate need that she had, and also based on the subsequent medical need that she needed. Along the line, we can see the multidisciplinary approach in her management, whereby the clinicians, the nurses, the psychotherapists, the legal advocate, the social worker, we are all integrated in her management so as to be able to bring her out of that situation and give her confidence to be able to what? To become a voice for others. And because of how she was well taken care of and she was led, and we can see Jane has become a what? An advocate in the society, not a rejected individual, because she was well rehabilitated. So that's why we are raising this awareness. That's why we are raising this campaign. Everyone that is here is important to ensure that a person who has passed through this experience, which is traumatic, and it's not something that one should in their life pass through. And never you say that someone who passed through this experience is their fault. It's never their fault, no matter what. No matter the kind of dress they wear that led to that incident, it's not acceptable in our society. That is why we are raising voices through you and me to champion this campaign and give them a voice and make sure that nobody feels inferior whatsoever. So in conclusion, comprehensive clinical care for survivors of sexual assault involves a multidisciplinary approach that addresses medical, psychological, and legal needs, ensuring a survivor-centered, empathic, and informed care process is essential to support their recovery and empowerment. It's not just to recover, but we want to empower them and give them a voice. This case study underscored the importance of coordinated care and the vital role of healthcare professionals, mental health providers, legal advocates, and community resources in supporting survivors of sexual assault. Key messages. Don't forget our history taking and examination. Don't forget forensic evidence collection. Don't forget treatment within 72 hours. After 72 hours, within 5 days, offer them protection against sexually transmitted infection and encourage them by linking them up with safe organizations that will give them empowerment and also give them a voice. encouraging them psychologically by linking them with what? Psychotherapists. And also linking them to what? Community what? Resource persons or resources to be able to what? To integrate them in the society. Before taking the history, providers should explain any obligation to report and limitations of confidentiality, because there may be some limitations. The patient, of course, needs confidentiality, but there are people that you must have to communicate with them so that they can be able to get help. So you are not telling those people just for discussion's sake, but because they will contribute to the treatment of this individual, of these survivors. That's why you are communicating, or you are informing or involving other people. That is a limitation of confidentiality. Obtain consent separately for each aspect of the exam. Collect forensic evidence only when all 4 conditions are met. You can remember. Let me take us back. This is the slide. When forensic lab is available, if the woman has come within 7 days and the woman wants to go to the police, and reporting that case is mandatory, then trained healthcare provider is also available. These are the indications. And before, least I forget, a rape, like I said, there is a definition of what a rape is, and you need to know. Ladies and gentlemen, a rape refers to any penetrative sexual intercourse through any of the opening, either their mouth, through the ears, through the nose, through the vagina, through the anus. If there is a penetration with sexual intention, it can be with the penis, it can be with fingers, it can be with an object, is considered a rape. However, you as a clinician, as an advocate, you don't have the capacity to call it a rape. You can only gather the evidence. And the court of competent jurisdiction is the one that has the legal backing and the power to say this based on the evidence that is provided to her, to call it a rape. Am I clear?
Yes, sir.
Yes, sir.
So please let this one never confuse you, and don't make mistake. So we've come to the end of our class. I hope it was interesting and engaging.
Yes,
For me, it was engaging. A lot of you contributed and gave their input to the discussion. So we'll now move to section of questions and comment and sharing of experience. It is welcome. If you have an experience, if you have a question or clarification, you can ask. So maybe you can raise your hand if you have, so that I can be pointing or giving chance based on the number of people that have indicated interest to contribute in this order or in this manner.
See my hand.
Sorry, some people were commenting at some point that they were not seeing my slides. Sorry. It's now that I'm opening the chat.
All right, thank you very much. Do we have any people who has questions to ask or contributions? I know it's a technical class for non-medical practitioners. It could be very heavy for you, but it's better that you have understanding of how it works. So that's what we are trying to do. All right, so let's take questions now. Okay, Mrs. Inyengi, do I pronounce your name very well? You can go ahead, please. You can go
Okay,
ahead.
thank you.
You're welcome.
Thank you so much for the presentation. In case of gathering evidence, sir, do we need to snap the face of the victim? If we are taking pictures, do we need to snap the face of the victim with it?
Okay.
Then the second question is, if the victim is a minor, and maybe when the case is being reported, maybe as health worker, you want to make, can you suggest that you want to report to the police on behalf of that child? Then the family, because of the person involved, they don't want the case to be reported, and the child is a minor. Well, the person cannot take decision on his or her own. So they find out that maybe it's the father's elder brother that did that, so they just want you to treat the case and let it slide like that. And the victim is a minor. So what?
I understand.
Yes, sir.
I understand. I got your question. Any other person?
Yes, sir.
Okay, let me take 3
You
questions.
can stop sharing. Dr. Matthew, you can stop sharing so that we can have a better view of your face. You can stop sharing.
Okay. It's all right.
Sir, I have a question too.
You're welcome. Go ahead.
So my question is, actually, I want to know the route for reporting a rape case.
Okay.
Yes, sir.
Is that all for you?
Yes, sir. So far.
Okay, it's all right. Thank you. I will respond to these 3. Then if there are other people, they will should indicate. Okay, for the first question that you asked, that can one snap the face of the survivor or the victim? Now, we said evidence. If the evidence is in the face and you didn't snap the face, for instance, there is a laceration on the forehead, there is a wound around the cheeks or around the lips, or there is a bite. So you can take a picture, including the face. But you know, there are various ways whereby you can what? You can maybe block the eyes of the person just to limit what? Exposure. But however, you know, this material is going to be used by only few individuals that will contribute to the treatment of or to the management of these survivors or of this victim. So it's not anyhow person that's going to have access to this information. So that's why you need to collect this information to the best of your ability, so that at the end of the day, you it can be justified that yes, this thing happened. Or if only the side of this evidence is in the face and there's no any other side. So you see, you cannot say you will not take that evidence. So in short, I'm saying you can take the face, because it's not only people that are involved in the management of this patient that will actually have access to it. It's not everybody. So just like if a patient presents to you, you see the patient now, is it they will come and block their face? No. You have to know who you are dealing with.
Thank you.
Are we together? So yes. The second question is
in case of a minor.
Okay, case of a minor. Okay, in the situation of a minor, and maybe the perpetrator is member of the family and they are not interested in reporting. Okay, this is what it is. Now, this, you've already said minors, they don't have a voice of their own. And the people who are supposed to stand for them, the first contact is the family, and they are not willing. Then the next contact is you as a health personnel. It's me as a health personnel. I am the next person to stand as a voice for them. So what do I need to do? You can involve the what? The social work. You can involve the social worker. They know the community. The social worker is part of their responsibility to be able to what? To trace this issue and also address this issue in a way that the victim, that's the survivor, is what? Their interest is protected. The family may not be protecting the interest of the survivor or of the victim because of their selfish interest. But for you, you want them to have a voice. And you don't want to leave them in a situation of what? Of regret for the rest of their life. So in the situation of the minor, you are not only dealing, you cannot deal with it alone. That's why you have advocates. But you know, there is a way you go about it. You don't just go about it anyhow. You have to link up with the social work, from the social work, maybe to advocates. There are legal advocates, you understand, that will come up and take up the matter. Why are we doing so? So that to prevent similar incidents from happening in the community, because we want our community to be safe. Then the next question is, sorry, can you just help me with the third question?
The second question is, I want to know the route of reporting.
Okay, the roots. Thank you. So the roots involve you. You can be an advocate in the community that get to know about this thing. You can be a health personnel working in a facility and the information and they brought the victim or the survivor. So from there, we have various agencies. There are non-governmental organizations. There are governmental agencies, such as the Women Affairs. They deal with issues like this in our community. They are there in the local government. They are there in the state. And you can inquire where their office is in your location, and you can link them. Or you can even Google, get information on agencies that take care of these issues. There are so many resources that you can be able to find around. But the easiest is the Women Affairs.
Okay, sir. Thank you.
Yes. And also the non-governmental organizations. There are non-governmental organizations that deal with issues like this. Thank you.
God bless you. Thank you.
You have another person. You have 4 minutes late. You're supposed to thank you, Dr. Martin. Yes. So who is going to give vote of thanks? Ida Osana, you are the one that will give a vote of thanks. Before you do that, do you have anybody who has any question? So okay, you have a question? Yes. Then if you look at the comment box, I'm going to drop the assessment for today's class. This class you have taken out now, we have 10 questions for you to test your understanding of what you have learned. And all the questions are scenario-based questions. So if you check on internet, you cannot find the correct answer. So I'm just telling you. All right, so check the comment box here. It's already on WhatsApp. It's already here. I'll drop it here in this Zoom class. Okay, take your question now. We have max you can go here is 6:20 because people will have to go and break their fast. All right, go ahead.
Hello, sir.
We can hear you.
Yes, thank you very much for this wonderful presentation. Mine is an appeal. It's an appeal. I don't know whether if there is a provision whereby like health worker can be trained on this forensic examination and then maybe and this forensic lab also. How to take samples and other things. I don't know whether if there is a practical aspect of it that we can involve. Thank you, sir.
Thank you very much. The forensic evidence collection, I try to be elaborate about it so that to give you a guide on what to do. And I was able to give itemized things to do for this individual so that you can be able to get your evidence. But the practicality of it is in a real life situation whereby you have to be there physically present in a center that deals with issues like this. And you'll be guided, you'll be seen by experts on how these things are collected. In a class like this, we cannot go more than what we've discussed here. So if you are working with an organization that is dealing with issues like this, I believe they will offer you this skill, this training to be able to take forensic evidence. But for us at this level, to give you the knowledge of what you need to do.
All right, sir. Thank you very much.
You understand? If you're working with an organization and you feel like you are not adequate to be able to do this, you can suggest to them that you will want forensic evidence training to aid you or to help you to be able to conduct this examination appropriately. I don't think the organization will be hesitant to do that because they really want to give you the necessary skills that you need to function effectively in the organization so that at the end of the day, they can be able to achieve what the targets
want to achieve. Yeah.
Yes.
All right. Thank you very much. Do we have any other question? Otherwise, I will ask Ida to give vote of thanks, then we wrap it up. All right. So if you check the comment box, the DCA is in the comment box. You can fill it before you leave the class. All right. Okay, Mrs. Inya, maybe this one. Okay, Ida, Osana, are you there?
I'm there. I'm here.
I can't see your face. Though. Where's your face?
Yes.
All right. On behalf of the class,
on behalf
I'm still trying to see your face. Where's your face? Okay, you are here.
You can see my face.
Okay,
it's evening already, sir.
Where are you joining us from? Which state are you?
I'm from Adamawa State, actually.
Okay, you are based in Adamawa at the moment?
Yes, sir. From Yola.
All right, thank you very much. Go ahead and appreciate our guest lecturer. You know, he's a busy man, you know, to have a doctor. This one is a technical class. And I know some of you are not medical doctors, don't be afraid. There is a video already. You can watch the video to understand it's more conversational in the podcast. All right. Thank you very much. Okay, go ahead.
Actually, I want to use this opportunity to thank our able doctor in the house that was patient enough to take us through this session. Today, I really enjoyed the class, which I believe most of my colleagues do. We pray that God will bless him.
Amen.
God will bless you, the coordinators of this. Thank you so much.
Amen. Are you a nurse? So are you a nurse?
I'm a nurse practitioner. And I have never participated in any workshop or so for this type of topic or condition.
But have you been attending to GBV patients before this time?
They may have met me some times ago. That you find out that it could be a policeman bringing them or a lawyer bringing them.
Okay, when they bring them, you don't have the capacity to understand the process.
Yes, I don't. I'll actually look for obstetric and gynecology doctor, refer them to, which will possibly do the normal examination and then give out the reports. Yes.
All right, thank you very much. We appreciate that, and we hope that we can take these learnings further. Thank you so much. So, Dr. Matthew, thank you so much. I really appreciate your class. Each time I listen to you, I'm just like, hey, why no go study medicine?
Thank you, sir.
Why no go study medicine? I was studying medicine. All right, thank you very much. All right, so it's important for you if you're in this class, go and fill the form. DCA form is there on the WhatsApp group. I'll open the chat now. If you have assignment to submit for us, go and submit assignment. Google form and Canva. You can see submit that between now and Friday. So, Dr. Matthew, thank you so much. Not good.
Thank you, everyone. It was a nice time with you.
All right.
Thank you, sir. Mhm.